Hey everybody, welcome back to OrthoNugs. In this video, I'll be demonstrating a few thoracic spine manual techniques. This first technique is going to be a posterior to anterior or anteriorly directed thoracic spine mobilization. I'm using my left hand, the second and third digits, to distribute the force across the transverse processes. My right hand is my mobilization hand. So we've established the barrier. You can see this is an oscillatory stretch mobilization technique. We can also progress to a higher grade, a Maitland grade 5 or an HVLA technique. We spring into the barrier. We have the patient exhale as we're applying that thrust mobilization. This is called a pistol grip. We're going to do a supine posterior to anterior thoracic mobilization. So you want to have a tight fist. You want to make sure that you can hold a pencil between your digits to assure that you're in a tight fist position, just to create a firm counterforce and also protect your hand. So the force will be distributed across the transverse processes on my first MCP joint and also the dorsum of my third middle phalanx. And then you can see I apply a downward force for the mobilization force. Now we're moving on to rotational mobilizations. We're going to follow, this is a staggered V position. We're going to follow the rule of the lower finger. So it's still an anteriorly directed force, but because of my staggered fingers, we're creating a left rotation at that segment. So we're on the right transverse process and then the left transverse process of the segment below to create a counterforce to, again, create rotation towards the side of the lower finger, which is called the rule of the lower finger. As the patient exhales, you can also do a higher grade thrust mobilization as well. This is just demonstrating the rule of the lower finger and how my fingers are staggered on the transverse process of adjacent segments. My mobilization technique is similar as it would be for a straight PA segmental mobilization. So this is a rotational mobilization now in supine. Using that same pistol grip, as I roll the patient onto her back, the reason this is different from the other mobilization technique is I'm going to make contact with her left transverse process first. Her left transverse process is making contact with my middle phalanx, which is creating that rotational force to the right. This is a side-lying segmental mobilization technique. So we're finding the spinous processes. This is going to be a rotational mobilization. So with my left hand, I'm blocking the spinous process. So I'm on the left side of the spinous process. And then I'm using my right forearm to create rotation. I can also use my thumb of my right hand on the right side of the spinous process to create more rotation at that segment. This is going to be a side bending segmental mobilization technique, again using my forearms to create the mobilization overpressure. I'm putting both of my third digits, the pad of my third digit, on the left side of the spinous process to create a fulcrum to really mobilize and bend around or create an increased side bending moment between those two segments. That last technique is different than this technique, which is more of a soft tissue 3-point bend technique. This is more just a gross elongation of the paraspinals on the right side. So the last two techniques look similar, but they are somewhat different. Segmental mobilization technique versus this is more of a soft tissue elongation 3-point bend technique. If you have any questions or comments about the information that was demonstrated or provided in this video, please feel free to add those. Also, if you feel the information was helpful, consider subscribing to our OrthoNugs channel. Thanks for watching.